If your ears feel clogged all the time, or you hear your own breathing echoing in your head, that might not be allergies or wax. A new study shows eustachian tube dysfunction comes in two very different forms, and one of them is incredibly hard to diagnose. This new research looked at patients with adhesive otitis media, basically when the eardrum gets sucked in because of negative pressure. And they compared obstructive eustachian tube dysfunction to something called patulous eustachian tube dysfunction. So obstructive means that the tube won't open, and patulous means that it stays too open. So two opposite problems, but they can actually feel very similar to patients. So as an ENT, I often see obstructive eustachian tube. It's very common. Ear fullness, popping, hearing loss. But patulous eustachian tube dysfunction is the tricky one. So patients hear their own breathing, their own voice echoing, or a hollow ocean sound. And weirdly, it seems to get better when they lay down. Many years can go by without the correct diagnosis, and it's very misunderstood. In my practice, I see a ton of patients who say, "My ears always feel off and nothing seems to help." This study helps highlight why treating the wrong type of eustachian tube dysfunction won't fix the symptoms. And patulous eustachian tube dysfunction requires a completely different approach. So if you've had ongoing ear pressure, echoing, or fullness in your ears for months, don't assume it's just allergies or fluid. Ask your ENT about obstructive versus patulous eustachian tube dysfunction. Getting the right diagnosis is the key. I'm Dr. Morgan Yost, helping you understand the research behind the symptoms.